pinning them into adduction, and you have your hand on the ASIS so that you know when this kind of starts to kick up a little bit that that's when we're hitting. So about right there for her is, you can see this kind of coming up, that's when we're hitting starting the stretch. And she's beyond 45, so this is not a tight muscle for her. For the stretch phase, you can do it one of two ways. You can do it the way I'm doing it. For someone who's shorter, has shorter arms, this is probably the way to do it. Pinning, you can either pin or you can have a little bit of help having them hook their foot on the other side of the table, and you're just putting them into abduction. You want to make sure that this inferior hand is putting them into medial rotation, so not to let it wants to go laterally. You want to shorten the muscle by holding it in medial rotation a little bit.
The contraction?
The contraction phase, thank you. I'll finish the stretch. So you're just going to be stretching. She is pinned here, so if you can't reach, just keep walking this out. So the contraction phase is just having her push into you, having her adduct into you, which makes sense because we're working on adductors. So again, just make sure you're holding the foot in medial rotation before you do it. Another way that we do it is holding the foot into medial rotation from the outside as opposed to here. That's a little bit harder for you. So holding the foot into medial rotation, and the leg is pinned here, or you can pin the ASIs, and then you're abducting this way. So either way, yes?
What's the angle for the midline that you want them to contract against?
As long as you can pretty much keep it in midline. Yeah, you don't need to bring it off the table and do it. It's just on the table is fine, and it's easier for you. And just push that fist down in there and have her contract against you. So abductors, Regina?